The following is a patient education tool for exercise with osteoarthritis. Osteoarthritis is a disease that affects the whole joint and includes structural changes. OA is the most prevalent joint disease treated in U.S. hospitals, with the overall prevalence increasing with patient age. Additionally, due to the aging and increasingly obese population, this disease is becoming more and more common, and currently 250 million people are affected in the world. Some risk factors for exercising with OA include obesity, muscle weakness, being of the female gender, and being older in age. A common question is whether or not one should exercise if they have OA. The simple answer is yes. There are numerous benefits to exercise. The exercises later discussed are ideas that your physical therapist may include in order to help you gain function and treat your OA. Benefits of exercise for OA are primarily reduced pain. Numerous studies have shown that aquatic exercise, land-based exercise, progressive resistance training, walking, and aerobic activity all have significant reduction in pain. In addition, there is an improved functional ability for tasks such as walking, climbing stairs, running, and other functional activities. Exercise has been shown to be just as good as drugs at diminishing your symptoms of OA, with reducing the need for those medications. Patients who exercise with knee OA showed no signs of worsening with the condition as a result of exercise. When it comes to exercise prescription for OA, it is important to consider both strength training and endurance training. It is important to begin endurance training with only 3 to 7 days per week, and if running or walking, it is recommended that you take more than 6,000 steps per day. With strength training, when you first begin, your physical therapist should prescribe 4 to 6 reps at approximately 40 to 50% of your 1 rep max in order to see how your body reacts. Once your body is acclimated, you should progress towards 80% of your 1 rep maximum in increments of 5 to 10%. In your strength training program, your physical therapist should implement 48 hours of rest before exercising the same muscle groups again. Another common question is whether or not to run with OA. It is a misconception that running will cause problems. In fact, it will actually provide multiple benefits. Disclaimer: OA exercise programs should be individualized to maximize benefits, but included are some common examples of exercise programs that people with OA can benefit from. Some examples of exercise with OA include flexibility training, which is stretching, range of motion, and yoga, aerobic exercises such as walking, running, biking, or swimming, resistance training, moving from static to dynamic exercises, and from single joint to functional activities such as sit to stand. Strengthening should also be incorporated to increase speed and power. These exercises are low impact and safe. Again, a physical therapist can evaluate your overall function and determine your biggest needs to develop an effective training program for you. Once again, please remember that prior to beginning the training program, it is extremely important to consult your physician or your physical therapist.